It really highlighted how those pressures touch every part of healthcare and the urgent need to address them thoughtfully. As we move into the final session of the day, it's time to look ahead and consider what's next for the healthcare industry itself. Our last discussion of the day is your healthcare organization ready for the next wave of innovation? We'll explore the strategies, tools, and mindsets needed to embrace emerging technologies, new care models, and transformative ideas. It's a conversation about staying ahead, driving impact, and preparing for what's coming next in healthcare. Please join me in welcoming our expert panelists to the stage. Let's put our hands together for Dr. Rajendra Sonawane, Director of Homoeopathic Clinics, Shravan Kumar Nidiganti, Enterprise Quality Leader of Benefits and Clinical Operations at CVS Health, Andrea Borda, Founder and Healer at Zero Point Activation, Dr. Dejar S. Patel, Chief Medical Officer and Chief Product Officer at Claritev, and Melissa Darrington, CCH of Happy Medium Hypnosis LLC. Let's give them a round of applause.
Good afternoon, everybody. My name is Dr. Jigar Patel, and I'll have to say this is a very different panel than I'm used to moderating or sitting on. I am a physician. I've been in, I trained as a pathologist. Transfusion medicine was my subspecialty, so very heavy on the sciences. I trained as an engineer before that, and then, of course, I went into technology. So when I think of innovation, my innovation comes from what are we thinking about from an AI technology perspective? And to the point where some of the things that were brought up in the last panel and some of the things we'll talk about here, I may be the purveyor of some moral injury that goes on by way of having worked in the medical record industry, electronic medical records, et cetera. And then, of course, the loss of control that's coming with AI as well. And so there is it's an interesting confluence of things that we're going to be talking about here today, bringing innovation not only from a technological perspective, but then also from a healing, a mindfulness perspective, and how do we get to a different place in thinking about this whole picture. So with that, I'm going to start the panel, and I'm going to let everybody on the panel introduce themselves real quickly, where they come from, and then we'll have some questions. So please.
Thank you. My name is Namrat Choksi. I'm a physician by training with a background in venture capital and private equity. I serve as the CEO of 10 Health, and we are a highly specialized provider of mental health care services for healthcare professionals. Thank you.
Andrea?
First of all, thank you for staying all the way to the end. My name is Andrea of Gaia, and I am the co-founder of 0 Point Activation, a whole health company bridging mindfulness and mental health. We teach neurolinguistic, NLP, mindfulness, meditation, breathwork, sound healing, and any modality that helps to connect mind, body, and spirit. We work with prison systems, with youth as young as 4 years old, people that has suicidal ideation, that they have touched rock bottom. We help them to bring back the light and to understand that they have a soul, that they have a spiritual life having a human experience. I'm a medicine woman as well, and a healer.
Thank you. Can you all hear me? Okay, yeah. I'm Shravan Kumar Nidiganti. I'm an enterprise quality leader with one of the largest health services company called CVS Health. So I manage benefits and clinical operations quality, where my work more focused on providing members or patients care more affordable and accessible and also predictable, right? With all this AI comes into picture. So I'm also a doctoral candidate in healthcare administration and patient safety, where I'm doing a lot of research around the cost and also the clinical trials, how the clinicals are working, and also the population health. Thank you.
Melissa.
Hello, Melissa Darrington, founder of Happy Medium Hypnosis. I have worked in surgical environments for over 25 years, so I've seen firsthand what our healthcare professionals go through on a daily basis, what's expected of them mentally, emotionally, and physically. And in light of this, it became clear to me that behind the systems, behind every outcome, behind every moment of care is a human nervous system. And so what I've been working on today, now at this point, is simple yet powerful because it's helping people to regulate in real time so that they can get back to themselves and perform at their best. Thank you so much.
Hi, I'm Dr. Rajendra Sonawane from Pune, India. I have been treating a disease called as psoriasis exclusively for last 39 years. It is an autoimmune disorder which has no cure in modern science. It can only be controlled for some time. But with my homeopathic medicines, I'm treating it with the results that when one goes through the complete course, he is free of disease and its medications for 10 to 15 years. This is my profession, no matter, but the thing that I'm worried and I'm doing the research now, because 40 years ago, when I was a student, in the textbooks it was written that this disease is common in the age of 30 to 40. The textbooks today says it's common in 18 to 25. And what I see today is children suffering from psoriasis. Just imagine children suffering from psoriasis on medication for lifetime. And 50% of the patient who have psoriasis, they get psoriatic arthritis and the life is disabled forever. So how we can control or how we can delay or how we can go back to 40 years where the disease was common in the age of 30, 40, or how we can avoid people getting psoriasis and all other autoimmune disorders, which was very common. This is what my subject is today. Thank you.
All right, so Dr. Chowsky, there have been lots of promising pilots over the years of care delivery models, of technology, digital types of engagement. Always one of the problems is how do you scale these while maintaining quality and experience? And then what differentiates innovations that actually get to that point that are successful? So, and then how do you go measure those?
Yeah, thank you for that question. So let me start by saying that what separates these pilots from actually scaling is rarely the idea itself. It's really the alignment around it.
Right.
Okay. I would say innovations that scale do three things. First is they embed in the clinical workflow. So there is if an innovation is going to create friction, it'll get through a pilot with some extra effort, but it'll 100% break at scale. Second, they should deliver strong economic value and a clear ROI, right? Like we should be able to measure those outcomes. And third, is it solving like a real problem, right? There is a bunch of things that kind of go in, and we see this at 10 Health, for example. We see firsthand that it's very difficult to kind of engage clinicians in taking care of themselves, and then it's just not enough to offer support. It needs to prove value to an organization. It needs to prove measurable outcomes for that clinician. Yep. And finally, it has to fit in their day-to-day schedule. My last point is, again, outcomes are not just economic, but I also think of them as, does this make things more accessible, right? Like, is there a population that was not served that's now getting engaged? Is there trust that's getting built? So I would, to summarize, say that those three things, economic value, solving a real world problem, and then finally ability to scale would kind of clear out an innovation from a pilot to a scale.
So I'm going to go off script here. In the last 10 years, have you seen a radical change in the environment of healthcare organizations in understanding what 10 does and the moral injury, as well as the outcomes that happen to clinicians, as we talked about a little bit earlier, the trauma that goes on from a day-to-day perspective as well?
Great question. So yes, again, because they've started to realize that, look, as C-suite executives, all of us are often looking at P&Ls. I always joke that I'm 51% a clinician first, and then 49% a CEO of a company. I think what has helped in organizations is, first, they have seen that, having a higher retention, for example, with people engaging in 10 services, leads to better patient outcomes, but also lower recruiting costs. Like, the cost of losing a physician,
Right.
about $150,000 odd dollars.
Yeah.
So I would say, yes, they've seen that. We've also seen that happier doctors can actually support happier P&Ls. So, you keep them happy and they feel satisfied in doing, and they feel like they're taken care of. One of the questions that we always ask is, do you feel more valued because Tend is available to you? And 90% of the times the answer is a roaring yes, right? So yes, to your point, I think we've seen that, and I think I'm hoping, we are in an era of budget cuts, but I'm really hoping we kind of tide through this. And
Yeah, I'm going to talk to my CFO next time and ask him if we could have a happy P&L, because I don't think that actually happens. So, Andrea, as we innovate in healthcare, how do we ensure we're evolving not just technology, but spirituality, with an understanding of the human system, emotionally, mentally, and physically?
Yeah, so this question actually has gone around through the entire conference. And when we think about innovation, we think about technology most of the times. But innovation is the whole, because we're spiritual beings having a human experience. What does that mean? We have emotions, we have a mind, we have feelings. We are human, we're physical, and we're spiritual. So when we work on the whole, everything is going to work very balanced, as within, so without. If we just focus in one section, there's going to be a big imbalance. So for example, I work with severe cases. They have attempted to commit suicide, and they didn't make it. And they go to these specific centers to find light again. So I can see how the imbalance on their nervous system, on their physical, on their emotional bodies, because they're just focusing on one thing. So for example, the growth of our company has been exponential, so quick, because we're focusing in all the levels. For instance, last year we did 2,800 sessions alone. And when we are able to balance the whole, we're able to work better. That's why burnout happens. That's why mental health is around everywhere. Right. Because the technology is just going so quick that it's really hard to keep on. And when we don't know how to keep on with that, we start getting depression, we start getting illnesses. And the illnesses is just stored trauma or anxiety stored in the nervous system. So it's very important to be connected back to the heart center. A lot of the clients that we work with inmates, with the prison system, with kids, they don't even know that they have a soul. When I talk to them, they're like, what? Do I have a soul? What? I didn't know that. Yeah, you're a spiritual being having a human experience. This is just an avatar. But there is no end and there is no beginning on your spirit. It's a continuous thing. So I don't diminish the medical aspect. I think there is a very powerful way to connect both, to interconnect both. And I'm super honored and super happy very happy to be experiencing this in this conference, because there's a two worlds emerging. Before coming here, I was like, oh, I'm going to be the woo-woo person talking about this. But I'm super amazed and happy to see that this is innovation, that we're all planting the seed to become better humans, better spiritual people. The world is awakening because we're seeing that there is something beyond that. We're seeing that there are feelings, that there are ways to heal the ancestral trauma, because we carry 14 generations of trauma, 7 behind and 7 front. And a lot of people, they're awakening and they're able to cut the cycle. And it's just so beautiful to witness. And we bring the mindfulness aspect, the mind, body, and spirit, to all these places that they have psychiatrists, doctors, psychologists. And we have seen firsthand that even the staff, they're burning so much in the centers because they don't know how to have that balance. So we're bringing that, and just the results, without us trying to make so many cells, they came to us. Hey, can you help us? Can you help us? How do you do? We're teaching people how to go within. As within, so without. We're mirrors of everything.
That's a great answer. Thank you. So again, I'm going to go off script. How do you feel digital therapeutics and technologies that are trying to advocate for mindfulness are helpful or harmful?
So it has the double side.
Yeah.
I believe it can be very dangerous for certain people that is not mentally stable.
Mhm.
But at the same time, it can be very beneficial because you can have that system that can help you 24/7. But there has to be a balance on that. So I believe that technology is going too fast, but the human is just going too slow. So there has to be a balance in between both because nowadays there are even people dating AI and all of that, and they're just drowning in depression and they forget to love themselves. So I believe it's good. I love AI. I love innovation, but there has to be a balance. And we are the change, the people that can bring that balance, to bring that awareness.
Thank you. Saravan, what structured change management and workforce development strategies are essential to successfully adopt new technologies in complex regulated healthcare environments? As working for CVS, you know, you're a large insurer as well. We all know that it's a very highly regulated environment. What do you think about that?
That's a great question. It's not only with CVS. Most of the healthcare companies are going through the change transformation here now. So in my experience, strengthening the healthcare quality, um, this technology adoption or innovation didn't fail because the solution is wrong,
Yeah.
right? The most of the technology adoptions are fail because systems are not ready, right? Systems are not ready. That means the readiness is not assessed properly, right? So in these healthcare environments, we need those structural change management models and the intentional workforce development models, which are essential for any kind of innovation or technology adoption to be very successful. So in my experience, what I saw was whenever there was an innovation or any kind of technology adoption going on, there is a major focus on, especially in the healthcare, the major focus on compliance, regulatory, and all these things to ensure that there is no any compliance issues or HIPAA or all these things. But one thing they always forget is about the people in the organization, right? So how that workforce development happens. So there are two things which I've looked at it is that change management happens. One is how early you involve the teams and also the subject matter experts into these technology adoptions or innovations. At the same time, what kind of workforce development, skill set development strategies we are going to put in place so that they won't feel that the technology change, right? Normally, most of the resistance comes not because of the technology, because people are not comfortable, not confident, and they are just they don't understand what's going on. What is there? From the technology perspective. So with these techniques, what I have noticed is it's it's like every time there is a technology or an adoption comes, this innovation should not be considered as like information for the people. Like it should be like you have to engage them as a design partners. Right? When you start engaging these SMEs and healthcare professionals as design partners, that's where everybody takes that accountability and they will understand what is coming in next 2 to 3 months. And then once we have that strategy that, hey, you have been involved in these innovation, next to 3 to 6 months, this is where we are going, and then come up with some kind of skill set development models. That is where people takes that strategy to develop themselves. And now what I saw was it's not only the organizational, because everybody thinks that organization is ready for the innovations or technology adoptions, but we need to also think how individuals are looking at the technology adoptions as well. Are they ready to take up those challenges, or ready to take up those learning opportunities? That's where the continuous learning comes into picture, where we need to establish that.
How do you get past physicians, nurses, other healthcare professionals and their resistance to new technology through change management? Because getting them to be a design partner is often very difficult. What are some of the techniques you use to get past that?
Here is what we need to have more communication with them. We need to give them the proper understanding, like, why we are doing it. What is that you're going to benefit from, right? So at the end of the day, the thought process, how we always think about what the patient is going to benefit, right? Whenever as a healthcare worker, the same way we need to tell them what is that you're going to bring by this innovation and everything. So if we can able to give them a proper structured information ahead, that is when the more questions arise and we can able to answer it. Because all this time, because everybody are busy and especially everybody talking about burnout, when they are burnout and suddenly comes back and say that, hey, we are going with a new technology, there is no time for them even to think about that, right? So that is the reason I was telling early and more communication and more thought process. And it's more about how you are creating that environment where people can able to express their thoughts and able to convince them that this is what we are doing. And what you mentioned is right. So like, for doctors, nurses, and all, uh, it's all about if you can able to tell them, hey, we are going to reduce this aspect of it, or you're going to save this time where you can utilize on something else. That is what is matters, because they are were completely stressed out.
Yeah.
So anything related to that, I think that is a catchy they can able to work with.
I met a physician in Tampa years and years ago, and he said he has three things. He has time, money, and quality of care. Those are the things he concerns himself about when he's taking care of patients. So those are all really, really important issues.
Absolutely.
Melissa, what would it look like to include nervous system regulation as part of a standard performance infrastructure? Because I've been through many wellness initiatives that didn't deliver. So how do you break down the barrier and get past that so that it does become has ROI, and you get people bought into the change management aspects of it as well?
Sure. So I've been playing around a little bit with this already. I've done a soft pilot in the OR where I currently am working. It is a level 1 trauma hospital, particularly for children. And so very high level stress. And what this involves is a 5-minute reset tool that is available just by scanning a QR code. So it doesn't interrupt flow. It can be done on break time, anytime, even like we're talking about when we're having a high level of stress and someone is not handling that well, they can take some time away, and it doesn't have to be a large amount of time. And this would allow them to recenter and be able to think and perform more clearly. And I think that's a great help for our organizations on the whole. I think the biggest thing is we've got to stop treating regulation as optional and include it as a wellness initiative. So just like we would train for clinical skills or for leadership, we would train for state, state regulation, because it's not just how you're performing, it's the state you're performing in. And that's going to make the difference as far as your performance level.
What are some of the techniques that you use to reset that state and get the state regulation back in order, so that using this QR code or any other techniques?
Right, absolutely. So I have a hypnosis background, and so I understand a lot about the brainwave states and being able to help others to drop into the theta state, if you will, and even just momentarily allows for that deceleration of the system and allowing you to get back online in a much better way and on a much better note, if you will.
Right. I wish I could decelerate in my life. I can't seem to get my hands around it.
Maybe you need to listen to my audio.
Maybe I need to do that. Dr. Sonawane, the life in general has become more comfortable externally. But that has come with an instability internally with a lot of people. How does that affect your practice, and how have you noticed that in your day-to-day?
See, as we see the modern life, the technology has advanced. Everything is quick, is there, and we get a quick answer, but we do not reflect on it. And because of this speed and the convenience, we are focused. We are focused for convenience. We are focused for comfort. We are focused for achievement. And in that, we lose the connections. We lose the connections to express. We lose the connections to our loved ones. We lose emotional connections. We lose personal connection. We lose social connections because we are too engaged in technology. And that creates the loneliness, anxiety, and stress. And all this stress, anxiety, loneliness, that creates an emotional burden. And all these autoimmune disorders are not biological originally. All this stress affects your immunity. And after affecting the immunity, it presents in the form of diseases. As a physician, and when we treat the diseases, we treat the symptoms, we treat the results. Diseases are not the problem, they are the signals. There is a disturbance in your internal environment. And if we treat the external, we only treat the last thing, but not the origin. That's the reason we today find that all these things that the young people are experiencing, the children are experiencing, this loneliness, anxiety, which is also called everything is available, comfort is there, but people are burnout. They are physically not exhausted, they are mentally exhausted. And that what creates the loneliness, emotional insecurity. But as a doctor, we measure the blood, measure the imaging, we measure the markers, but we don't measure the emotional burden. The most important thing that in my research I found, when the children get psoriasis, so what they do, they have the stress. And I have found all the children who are suffering from psoriasis, they are not at the fault, but we call it a family dynamics. Family dynamics means the relationship of husband and wife.
Yep.
So if that is disturbed, the children feel insecure, they feel confused, and their body expresses in autoimmune disorders. So I think as a health, innovation, and the technology helped us to control the autoimmune disorders. But did the technology help us to live the life in its whole extent? The life is not the achievement that we are achieving externally, but it's the experiencing internally, emotionally, socially. So is the next innovation is about the treatment of diseases or about the human life, how we can explore and experience. Man is a social animal. It's not a person, it's not a machine who is sitting in front of the screens throughout the day. And at the end of the day, he's exhausted not because of physical, but because of his mental, overused mental power. I think we have to rethink on it.
Yep. So how do you address the family dynamics in the treatment of these children with psoriasis? What's one of the techniques or several of the techniques you use to do
There
that?
is a saying that whenever there is a problem child, there are no problem child, there are problem parents. So we have to treat, we have to advise the people for the proper upbringing.
Yep.
It's not the treatment. Treatment is temporary. If you want to last the treatment for a long time, we have to see the causes. We have to align the family. We have to align the person. We have to understand his emotions. And fortunately, homeopathic treatment covers all these things. It treats the mind, it treats the emotions behind the disease. Diseases, again, I say, they are the signals of internal disturbances. You treat the internal disturbance, and the body knows how to heal. This is what homeopathy helps the body to heal itself by giving the help through medicines. That's the reason that the patients are free for almost 10 to 15 years without the medicines. I think uh, the latest modern medicines, what they can control immediately, but I think it should be integrated to all this hypnotherapy, meditation, the homeopathy.
Yep.
I think we should come up with the one final integrated medical system
Yep.
that covers all.
Yep.
Thank you.
Andrea, you wanted to comment?
Yeah, I would like to add something. Thank you, doctor, for that. And I have been able to see something that I never imagined that existed. That is kids as young as 4, 5, 6 years old committing suicide. And at that age, until you're 7, 8 years old, your mind is not developed. You're a sponge. You're a sponge, you absorb everything. So it's not to judge or to blame it on the parents, but there's so much unresolved trauma that is given through generations and is given through the fights or starting. The first trauma starts from the belly, from when the woman is pregnant. The second trauma is when the baby comes out and then it goes to all the medical places when, for example, abandonment is such a strong trauma, and it is when they go into an incubator and they feel like, okay, I'm alone. What is all these machines? And that's something that a lot of parents, I would love them to understand. Whatever you say, however you act, however you behave, however you talk to your partner, they're going to absorb that. They're going to be a mirror of that. So, for example, autism exists because of developing these kind of things. All these I don't like to put labels on these illnesses, but they're all developed not when we're born. We're born with a clean slate, complete clean, and we absorb everything. That, oh, the kid is scared of throwing up, vomiting. That doesn't come from the kid. It comes from the parents. There is a beautiful, amazing test of babies younger than a year old. They put snakes all around. They're not afraid of them. They just want to touch them and play with them. They have no idea that a snake can bite them. Why do they get scared? Because the parents, they're scared of them. They bring that. So it has to start from the home. So it's not just the 1 hour, the one patient. That the system has to go to the seat, the home, and educate them how to talk, how to be, how to behave. And that can help to evolve a lot.
Well, I'll open this question up to everybody. As you think about the individual expertises you each have, how do you get past those fears and things that have been ingrained in people for so long, whether it's technological change, whether it's mental health parity? How do you think about getting to past those issues that people will bring to the plate to bring effective, better wellness for the healthcare provider, or better quality of care, or better nervous system regulation? You want to start, Dr. Chowsky?
Of course. So I think one thing that we try to do, kind of take down that barrier, is first establish that we're all humans.
Yeah.
You know, sometimes with physicians or nurses, they're often like they put themselves on a very high pedestal, or people put them on a high pedestal, and be like, okay, you know, I remember when I was in medical school, and I was sick, and I missed a patient's appointment, and the patient walked by and said, "Oh, doctors also fall sick."
Yeah.
I was like, I'm a human,
Yeah.
right? So I think first establishing that, hey, we're humans, and it's okay,
Yeah.
you know, to open up. It's okay to cry.
Yeah.
I think helps us with that barrier. Second, in our case specifically, for example, we are available late nights, early mornings, weekends. You know, you can't take a resident to take 2 hours off, you know, to seek mental health care support. We're available within 6 hours. We do not put session caps.
Yeah.
And finally, one thing that we do, which resonates really well with all the attending clinicians, is we don't trigger insurance.
Yeah.
So by virtue of that, we don't have to put a diagnosis. A lot of times, physicians are very scared about, you know, things getting on record, you know, their life insurance going away, their malpractice going away. So I think just trying to understand, to Shravan's point, where they're at and what they need, and then trying to revolve those solutions around them, I've found that to be incredibly helpful.
Yep. Any other comments or thoughts?
Yeah, I would like to say that it's very, very important to all of us to meet every person where they are, because not every person is at the same level of healing. And maybe what worked for me is not going to work for that person. So we need to meet them where they are and really listen, really understand the deepest of this role, because a lot of the times we try to, the medical industry, they try to just cure the symptoms, but there is a lot behind that. So it's to meet people where they are and to understand that it's not a race, it's a journey. And it's a never-ending journey, and we're always going to keep upgrading, learning, and that it's okay to fall, but you can stand up again, and you can fall many times. Not everyone has made it just like that. Egypt wasn't built, the pyramids wasn't built just in a second. It took time. So it's to acknowledge that we're humans, to understand that it's okay to make mistakes, to stand up again, to explore and to get to know ourselves. Because a lot of the times, a lot of people don't even know who they are. And when I ask a person, who are you? They come, I'm a doctor, I'm a physician, I'm a father. No, those are, does your work, that's your responsibility, your father, but who are you? You're love, you are creative, you're happy, you're joyful. So it's just having that human and spiritual mind, body, spirit connection and just meeting everyone where they are. Like to understand that a doctor that is skeptical about all the things, okay, you don't have to talk about just all the spiritual experience and that. Just meet them here and start baby steps. And to understand that not everyone is ready. And they will come when they're ready.
Yep.
And that helps to kind of put down the wall that a lot of people has like, I don't want to listen to that. I don't want, that's too much.
Yep. And a technique I've taken on especially with meeting new people, is I don't ask where you're from or what do you do, et cetera. I ask them, where do you like to go on vacation? So you change the narrative, so you change their way they're thinking about it, and the interaction becomes totally different. And then you break down barriers and you move past it. So I think there's a lot of subtle things you can do to really open people up in a different way, so that they can hear you, which is really, really important. Is that you're talking about the existential dread of technology that's always present in our daily lives. Sarvan,
Yes.
Melissa, any
So
thoughts?
my thoughts here, right? What I say is the mindset. So what we need to work with healthcare professionals, right? Is the mindset shift, right? So now, what my experience when I was talking with so many healthcare professionals, they are more focused on uncertainty
Yeah.
rather than their skill set,
Yeah.
right? When they do that, they need to understand any kind of health transformation or any kind of technology innovation. Always, technology without domain expertise definitely creates gaps, right? That gaps is definitely is critical in healthcare, right?
Yep.
So that is where at this current situation with technologies like AI going so uh, faster pace, you need to understand the domain expertise, physicians, subject matter experts, clinicians. They are very important than ever,
Yep.
right? The role of the expertise is very important to question the transformation and ask what it is aligned to, whether it is aligned to our ethics, compliance, and also patient care. What is the level of, it's not about, they will say 99.9% accuracy, but what about that 1.1% accuracy? If that is going to impact any lives, that is something all our healthcare professionals are focused upon. So if we can able to discuss that with the healthcare professionals that, hey, you have to believe in your skill set. At the same time, we need to upskill, understand what exactly the technology is, how I can relate the technology to the skill set I have and add value to the technology. So when I was talking with some the professionals, hey, they told, hey, I can't learn this coding, with the technology, what is going on behind. No, we don't need to, because you're all domain expertise. What you need to is you have so much experience understanding the data, and then what you understand, what you need to ask question is how you are using the data, what kind of models you are using, and what kind of outputs you are trying to get, what is the issue rates, or what is the error rates. So those kind of questions trigger them to do more work more efficiently. So that kind of conversation with the healthcare professionals definitely is going to work.
Yep. So final question before we get into question and answer. I have to bring it up. So how is AI affecting each of your daily operations and your daily interaction with people that you're trying to convince of doing something different? Because I tell everybody I have this existential dread as a physician, as a technologist, around AI. I think the domain expertise is 100% an accurate statement, and it is the thing that will keep knowledge workers engaged. But how broadly, anybody can start, how is AI affecting the day-to-day as the latest and greatest, newest innovation that we all have to deal with?
Yeah, as far as I can say from the AI perspective, I personally have used it to help me to develop the program that I have or the tool that I have at this point
Mm.
around nervous system regulation. It helped me to know how to verbalize it in a way that I can help the healthcare administrators and things of that nature to understand how a tool that is hypnosis and otherwise evidence based can be helpful and useful within an organization such as healthcare or any high stress environment, and how this can be helpful to their bottom line more than anything. It is scalable, it is trackable, traceable, and does give the results in real time. And to be able to regulate and reset yourself and be able to do what you need to do is huge when you're in the middle of that stressful situation.
It's I have a colleague that actually used AI to write a birthday note to his mother, and that note, mother knew right away it wasn't written by him, but it was more empathetic than any note he's ever sent her.
It can help.
And in fact, there are a number of studies that are like AI is more empathetic than physicians when talking to a patient even. So it's interesting, and I've used it in my corporate career to help develop language and other things that take into account everybody's view. So it's actually an interesting tool that way that it can, besides being pure technology, help you bridge the gap to the emotional, mental states that are there.
Absolutely integrate and help to bridge the understanding between different worlds.
Yep. Andrew, you wanted to say something?
Let's see.
Yeah, Dr. Sonawane?
That technology has an important role to play here. It is not enemy. It has saved millions of lives
Hmm.
and continues to transform medicine. But technology should support human well-being,
Mhm.
not replace human connections or reduce human awareness. How do we combine technological advancement with human balance? How do we ensure that innovation reduces suffering, not only physically but emotionally and socially? Because when we look closely, some of the most powerful healing factors are very simple: a meaningful conversation, a sense of belonging, emotional security, a purpose in life. These are not luxuries, these are fundamentals to health. When a person feels safe, emotionally, mentally, and physically, the body responds differently.
Mhm.
In many ways, the body already knows how to heal. It only needs the right environment. So, as we move forward and we are preparing only for the next technological breakthrough, or we are preparing for the next stage of human well being. Because at the end, health is not created only in hospitals or laboratories, it is created in the way we live every single day. And technology can help human beings rediscover balance, connection, and purpose. Then it will not be just innovation, it's true progress. I think can technology help us for this?
Right. Yep.
Yeah, I would like to add that AI has helped me a lot to everything. But again, it has both sides. I think for us and for the entire world, it helps them to take out this stress of either financial or time consuming or look for the right team or something. So that helps to be able to focus our energy and our time in something different than just developing something else. But at the same time, we gotta be careful with that. When I started using AI, I realized that I was not thinking, that my brain was getting kind of numb. And it was really hard to write emails, even text messages. I was like, I don't know what to write. And then I had to kind of come back and write everything how I think. And because I'm Colombian, I might maybe make mistakes sometimes. I just said, help me to correct the grammar and make sense on what I'm saying. So we have to be careful in how we use AI. And it's just the beginning because it's going to numb us.
Yeah.
It's going to make us dumb.
Yeah.
So we do have to be really careful. We have to know how to use it to make us more advanced, to learn more things. I love talking to AI in the car, asking all the questions because it's a person that is a person. I'm calling it a person already. Is the system that it has all the answers. But it's important to keep reading books, to keep, okay, the AI told me this. Oh, that's interesting. Let me read a book on this, to ask and to get to meet other people in the industry. Because it's so funny how AI just sweet talks to you. Like, oh, you're right. What you said is brilliant. It's never going to tell you you're wrong. It's always going to tell you that. So it goes from both sides, like everything. Like any addiction is too bad if you go too much. So we have to be careful. And with the youth, we have to be very, very careful because nowadays, a lot of kids don't know how to think. And the attention span is so, so bad. Where is the world going to go? We're going to leave it to them. So it has both sides. And if we keep us bringing the side of the bright side and how to use it in a conscious way, then we can evolve a lot. But if not, we're going to be going back to being monkeys again.
So what I tell people is AI helps unlock curiosity, but you have to keep being curious, right? You can't stop because then your brain stops. So thank you all for this panel. This was fantastic. We have a couple minutes for questions. There is a microphone here if anybody has any questions they'd like to ask our esteemed panelists. All right, we answered all the questions. That's fantastic. All right, so thank you all again.
I would like to do, just to close everything, I have a Tibetan bowl here. And I would like everyone, if you want, I invite you to close your eyes. And just let's take a couple breaths together. Yeah, I need a micro. Okay. Can you hold it for me? So thank you. I invite everyone to close your eyes first. Take a deep breath through your nose all the way in. Inhale. And exhale. We're going to take another deep inhale, bringing life force energy, love, breath, strength, and gratitude into your mind, into your body. Inhale. And we're going to exhale anything that is not serving us anymore. And we're going to do our last inhale, bringing gratitude, love, closing this journey, bringing awareness into mental health and mindfulness. Inhale all the way in. Hold it for a little bit. You're strong, you're powerful, you're enough. Hold it for a little bit long. And when I tell you exhale, we're going to exhale everything that we don't need, and we're going to make a little bit of exhale. And when you're ready, you can open your eyes.
It was amazing.
Thank you.
Thank you. Thank you.
Namaste.